Hello, in today's segment we will be observing Bess. Bess is a 27-year-old accountant living in upper-class neighborhood of Vernon. She has decided to seek help regarding intrusive thoughts and daily habits and rituals that are beginning to become disruptive to her life. Throughout the following video, we will get to know Bess and learn about obsessions, compulsions, and the age-related onset of obsessive-compulsive disorder. Please sit back, relax, and enjoy the following presentation.
Hi doctor, I'm Bess.
Hello, Bess. What brings you in today?
I feel that I need to talk to someone about my thoughts and my habits.
Can you tell me more about those thoughts and habits?
Yes, my thoughts and habits are beginning to take a lot of mental and physical energy.
Can you tell me what these thoughts and habits consist of?
They revolve around cleanliness.
Can you tell me more about that?
Well, I have a fear of contamination, and my fear is beginning to consume part of my life.
Obsessions are persistent, unwanted, intruding thoughts, ideas, or impulses. Common obsessions include fear of dirt or contaminating by germs, fear of causing harm to another, fear of making a mistake, fear of being embarrassed or behaving in a socially unacceptable manner, fear of thinking evil or sinful thoughts, need of order, symmetry, or exactness.
Can you tell me more about that?
It didn't used to be so bad. First, it started out only when I was at home after I used the washroom. I just keep thinking about all the contamination, so much to the point where I become overridden with anxiety, and the only way to subdue that anxiety is to undress myself in a specific sequence and then place each item in specific spots on my bed to examine them for contamination. If I ever feel that I miss a step, I have to start all over. I completely distressed by contamination.
It would appear that Bess has an obsession with cleanliness or a fear of dirt or contamination by germs.
Okay, Bess. Then what happens?
Once my clothes are off and I examine them for any germs or contamination, I then shower, starting at my feet all the way to my head. I also use different washcloths for different parts of my body. Just want to make sure no contamination goes along.
Okay, Bess. How often does this occur?
4 or 5 times.
A day?
About 4 or 5 times each cycle, multiple times a day. But that's not all. It first began with just undressing and showering ritual, but now I'm having obsessive thoughts about all sorts of things, from contamination on the toilet to sexual issues. I know these thoughts and behaviors are absurd, and they're beginning to interfere with my work, so that's why I'm here.
Compulsions are repetitive, ritualistic behaviors or mental acts that are meant to lower the anxiety or distress caused by obsessive thoughts. Common compulsions include bathing, showering, and washing hands, refusing to shake hands or touch doorknobs, repeatedly checking things such as logs or stoves, constant counting, mentally or aloud, while performing routine tasks, constantly arranging things in a certain way, eating foods in a specific order, being stuck on words, images, or thoughts, usually disturbing, that don't go away and interfere with sleep, repeating specific words, phrases, or prayers, needing to perform tasks a certain number of times, collecting or hoarding items with no apparent value. It would appear that Bess compulsively undresses and bathes.
Okay, Bess. Are there any triggers or rather events that may compel you to do these habits?
Yes, every time I use the washroom or I touch down there.
Okay, let's get a medical history real quick. Do you use any medications?
No, but I do use sleeping pills to help me fall asleep.
Okay, and how about alcohol or caffeine?
I drink wine
How often?
frequently.
It has been estimated that nearly 30% of people with OCD have had a substance use disorder at some point in their lives. This is nearly double the rate of general population. Most people report that their OCD symptoms started well before they developed substance use disorder. It's significant to know that people with OCD who develop substance use disorders are at a greater risk of suicide and hospitalization.
And what do you do for a living?
I'm an accountant for a large manufacturing firm.
And do you enjoy that?
Yeah, I spend most of my time at work, and I've been really successful at my firm, but as of lately, I've had a really hard time focusing because I've been so fixated on these thoughts.
Okay. And what about your free time?
Well, I don't have a lot of time for socializing because work consumes a lot of my time, but I do like to read, and I do visit my mom frequently.
Bess has often been regarded as perfectionist. However, in the field of accounting, perfectionism is generally regarded as functional. Perfectionistic behavior is often found in those with obsessive disorders. Bess has regarded her work as the one remaining source of meaning and satisfaction in her work, and she has sought out help because her habits are beginning to intrude on her ability to carry out her work.
And are you religious?
I was raised Methodist.
Okay. And are you sexually active, or have you been sexually active in the past?
I have in the past, not now.
Okay. Thank you for sharing that. And how about your family dynamic? Do you have any siblings, or are your parents together?
I'm an only child. My parents divorced when I was 10. My mother raised me. And my father was part of my life, but it was very sporadic.
And, you mentioned that you spend a lot of your free time with your mother. What's your mom like?
She's loving. She expresses her love by always helping me improve myself. That's how she shows her love for me.
And can you tell me what she does to try and help you improve yourself?
Yeah, well, growing up, she always encouraged me to keep things in order, take various types of lessons, always pushing me hard in school, and being a really active member in our church.
Okay. And how did that make you feel?
Well, her encouragement was helpful for my academic achievement, but of course, as a kid, we would argue over not trying hard enough, or not keeping my room clean enough, or not following the rules of my church. My mom has always been a little fanatic about keeping things clean as possible.
And did you enjoy being in your church activities?
I mean, for the most part, yes. But I often struggled with having the concern if I was sinning or not.
Okay. And what would you consider to be a sin?
Well, I wasn't very well informed about sex, and my mind often wandered into erotic fantasies.
Okay. Well, that's normal, during that age to be curious about sexual things, so don't worry about that. But how would you manage these thoughts?
Puzzles. I would play puzzles for hours at a time.
Okay. And did that work for you?
At first it did, but eventually I just found myself defenseless against my thoughts.
Okay. And in these defenseless states, what would you do?
I would masturbate in binges. But, eventually I found a boyfriend, and, he became sexually active.
Okay.
So I stopped.
Yeah. Was it safe, sane, and consensual?
Yeah, for the most part.
And what do you mean by for the most part?
Well, I was uninformed about safe sex, and eventually I got pregnant. It was my senior year of high school.
If you're interested in learning more about safe sex, please go on to www.cannedparenthood.org or www.safesexnoregrets.nt.gov.
Can you tell me more about that?
Well, it all happened so fast. When I found out I was pregnant, I told my mother.
And how did she take the news?
She immediately arranged for me to have an abortion.
Is that what you wanted?
I never had a choice.
After your abortion, what did you do? How did you feel?
Well, almost immediately after, my mother arranged for us to go on a trip to Europe. She strictly watched over me, but I think she was just trying to make me feel better. The worst part, though, was when I got back. My boyfriend, the father, he started seeing someone else.
And how did that make you feel?
Well, I found myself putting more time towards school. I eventually became a top student and eventually a successful businesswoman, but I have anxieties now about dating, marriage, about having a family, and other relationship issues.
And when these anxieties arise, what happens?
Well, this is when I begin to experience symptoms of, focused on the issues of cleanliness and obsessive thoughts.
After a month of counseling, Bess was diagnosed with obsessive compulsive disorder, also known as OCD. OCD is a disorder in which intruding, recurring thoughts or obsessions create anxiety that is relieved by performing a repetitive, ritualistic behavior or mental action, often referred as to a compulsion. OCD affects about 3.3 million adults and about 1 million children and teens in the United States. The disorder usually first appears in childhood, adolescence, or early adulthood. It occurs about equally in men and women and affects people of all races and all socioeconomic backgrounds.
Although symptoms of obsessive compulsive disorder can begin at almost any age, research suggests that there are two distinct periods when OCD symptoms are most likely to appear. The first occurs around the ages of 10 to 12, or just before puberty, and the second is between the ages of 18 to 23. People who develop OCD before puberty are considered to have early onset OCD, while those who develop OCD later in life are said to have late onset OCD. Interestingly, there may be distinct differences between those who have been diagnosed with early versus late onset OCD. The differences include the symptoms, response to treatment, overlapping illnesses, brain structures, and thinking patterns. One of the biggest differences between early and late onset OCD may seem to be between the ratio of males to females. Studies have consistently found that males are much more likely to develop early onset OCD than females. This gender difference, as we pointed out before, seems to balance out among people who develop OCD later in life, with males and females being equally as likely to develop the disorder. It has also been noted that earlier symptoms appear, the more severe the symptoms are, and the more difficult they can be to treat. Another difference is that people with early onset OCD have a gradual appearance of symptoms, whereas people who develop OCD later in life tend to have symptoms that come on quickly and that are usually tied to some sort of trigger, like a stressful life event such as death of a loved one, loss of a job, or failing out of school.
Although the exact cause of OCD is not fully understood, studies have shown that a combination of biological and environmental factors may be involved. As for biological factors, the brain is a very complex structure. It contains billions of nerve cells called neurons that must communicate and work together for the body to function normally. As we previously learned, neurons communicate by chemicals called neurotransmitters that stimulate the flow of information from one cell to the next. At one time, it was thought that low levels of the neurotransmitter serotonin was responsible for the development of OCD. Now, however, scientists think that OCD arises from problems in the pathways of the brain that link areas dealing with judgment and planning with another area that filters messages involving body movements. In addition, there is evidence that OCD symptoms can sometimes get passed on from parents to children. This means the biological vulnerability to develop OCD may sometimes be inherited. Studies have found a link between a certain type of infection caused by the Streptococcus bacteria and OCD. This infection, if recurrent and untreated, may lead to development of OCD and other disorders in children. As for environmental factors, there are environmental stressors that can trigger OCD in people with a tendency towards developing the condition. Certain environmental factors may also cause a worsening of symptoms. These factors include abuse, change in living situation, illness, death of a loved one, work or school-related changes or problems, and relationship concerns.
The brains of people with early versus late onset OCD may be different from one another as well. Brain imaging studies suggest that people with early onset OCD have a reduction in the size of certain brain regions that are not evident in people whose OCD started later in life. Interestingly, however, studies have consistently demonstrated that people with late onset OCD score poorer on measures of cognitive function than do people with early onset OCD. It is not yet clear why this is the case and whether this may have any impact on treatment.
As for treatment, OCD will not go away by itself, so it is important to seek treatment. The most effective approach to treating OCD combines medications and cognitive behavioral therapy. The goal of cognitive behavioral therapy is to teach people with OCD to confront their fears and reduce anxiety without performing the ritual behaviors, also called exposure therapy or exposure and response prevention. Therapy also focuses on reducing the exaggerated or catastrophic thinking that often occurs with people with OCD. Antidepressants such as selective serotonin reuptake inhibitors or SSRI like Prozac and Zoloft may be helpful in treating OCD. However, older drugs like triacyclic antidepressants might be also used. Some antipsychotics have also been shown to have value for OCD either when used alone or in combination with an SSRI. In severe cases of OCD and in people who do not respond to medical and behavioral therapy, electroconvulsive therapy or ECT or psychosurgery may be used to treat the disorder. During ECT, a small current is passed through electrodes placed on the skull while the patient is asleep under general anesthesia. This causes a brief seizure, however. Repeated ECT treatments have been found to help improve OCD symptoms in some areas. A newer surgical form of brain stimulation called deep brain stimulation or DBS involves in implanting small electrodes into brain areas that are part of the brain circuitry associated with OCD symptoms.
Thank you for watching this segment. We hope you have learned a little bit about Bess, a typical patient with late onset OCD, as well as a little bit about obsessive compulsive disorder. If you have any further questions, please feel free to ask.